Welcome to Transform Now, the podcast brought to you by robotic process automation pioneer Blue Prism. Digital transformation has the potential to reshape the way companies service their customers, engage their employees, and manage their operations. Whether you're looking to develop strategies, tactics, and best practices to positively impact the future of work, or you're curious to learn how other companies have successfully navigated their digital transformation programs, then this podcast is for you. We're here to help you transform now.
Hello, everyone. I'm Brad Hairston with Blue Prism. Welcome to the Transform Now podcast. Today, I am very pleased to have as my guests my colleagues, Duff Glaser and Anna Twomey, both of whom are very experienced in and focused upon the healthcare industry. I'm going to be talking with them about the digital transformation opportunity in healthcare and why this industry is ripe for change. Duff and Anna, thanks so much for joining me today.
Hey, Brad, it's an honor to be here. Thank you.
Thank you, Brad.
So why don't we start with some introductions? Duff, you go first, and then Anna, you can follow him.
My name is Jeffrey Glaser. My friends call me Duff. So I would hope everybody, if you want to message me, talk to me, please refer to me as Duff. I've been in healthcare for over 35 years, cutting my teeth at Citicorp and mergers and acquisitions back in the 80s. All the way through my technology career, helping healthcare organizations adopt new technologies, ACA focus, patient-centric focus. The bottom line is we're helping organizations adopt, adapt, and meet the new challenges that are necessary to bring healthcare into the future centuries.
I'm Anna Twomey. I'm the Senior Solutions Engineer and Advisor for the Healthcare Industry Practice here at Blue Prism. And my master's in information systems, but my focus on the technical side in leading edge software deployments for the industry of healthcare. I've been working in healthcare for 25 years now, and I've served in a lot of roles throughout the healthcare industry, including private practice consulting and advisor to many of the healthcare organizations, both the private and public side, such as HHS, NIH, CDC, WHO, UK, and Saudi, as well as a lot of the commercial payer and provider organizations across North America. I'm happy to be a part of Blue Prism's healthcare team, and the last 2.5 years, I've been focused on that, with intelligent automation being my idea of a game changer for the healthcare industry. So hopefully we can give you some information on that today.
Excellent. Well, the healthcare industry has certainly been front and center as we've all grappled with the global pandemic. And now that we are fortunately starting to emerge from COVID-19, a lot of the attention has turned toward fixing the systemic healthcare issues that were greatly exacerbated during the pandemic and truly move toward transformation. So, Duff, let's start here. What does the workforce of the future look like, and how is this applicable to healthcare?
Yeah, well, I think you just gave me a fantastic lead in that as we come out of this COVID fog that we've been in for the past 16 months, COVID really uncovered a lot of warts to the U.S. healthcare system. And part of those warts were how we look at the U.S. workforce, our primary caregivers, our first line responders. And what's occurred is the conversation around what does your workforce look like has really come front and center, because it's no longer just about the workers that work 9 to 5, the doctors that work 12 to 12, et cetera. But you now need a third workforce. That third workforce is taking, and I don't like using the terms menial, repetitive work, but it's taking specific parts of a workflow that are repetitive, and we're automating it, and we're able to do it 24/7. So all of a sudden you have this third workforce that's out there taking work out of the hands of administrators and physicians that take time away from the patient and can work on it 24/7. So maybe one of the silver linings from this COVID coma that we're waking up from is that we now have a third workforce that can work 24/7, 365, and allow physicians to focus on patients more instead of administrata. That's my view.
So, Duff, what are some of the biggest problems that intelligent automation solves in healthcare? Could you touch on that?
What intelligent automation brings to healthcare is it brings the ability to reduce error rates and really help, if you look at it from two perspectives, the back office and the front office. So let's first focus on the back office. So intelligent automation allows organizations to take aspects of their revenue cycle and automate it and really help reduce the number of errors that cause claims to be denied. And in reflection, if a claim is denied, that it affects the organization's cash flow. So if we can automate the full revenue cycle, and when I talk about the full revenue cycle, I'm not really talking about the processes. I'm talking about the workflows from when the patient goes to that virtual door and has to start their healthcare journey, that a physician's advocate or a patient advocate can hold the hand of that patient and make sure that from the beginning of their journey, when they're registering and they're getting pre-approved by their insurance, that digital worker can do all of that. And then when it comes down to the services that they receive, that digital worker can then make sure that the coding is correct and that it's being filed correctly with the insurance company, thus taking away a lot of the angst that the patient feels. What is this going to cost me? Am I going to keep getting bills for the next 30, 60, 90, 120 days? If it's done correctly, we take that angst away from the patient. We take away that work from an individual and allow them to focus on other more important tasks. So we can actually impact the patient's journey and make it more pleasant on the front end of the hospital, all the way through to the back end when their claim is getting adjudicated and the hospital is receiving its payment.
Okay. Anna, let's turn to you. Can automation really impact the patient user experience?
Yes, Brad, I can tell you that automation of tasks can definitely impact the patient experience, and the use of automation in assisting in patient engagement and patient journey alone has shown increases in satisfaction from the patient point of view, with less hassle for the patients to have to set appointments, checking in, checking out, making sure that new visits have been scheduled properly. In many cases, with proper automation, the patients have digital advocates, as Duff was alluding to, that actually pre-schedule visits for them based upon their care plan. Additionally, automations in billing and referrals and authorizations and the posting of payments, that allows the patient accounts to bring immense value in adjudicating those claims and keeping those claims current and patients happy. As Duff mentioned, that there's not a single thing that a patient doesn't want to hear more than, I see that you have a balance on your account. How would you like to take care of that today, when they start to go in to see a doctor and they're sick. But especially when the patient knows that their account should be current and in good standing, and then they get something like that. But usually that's an indicator that there's a backup in rev cycle or things like that, where human intervention is taking place in the back end systems. With automation and that revenue cycle management, we can make an immediate impact in that area while keeping the patient informed, keeping their satisfaction levels up, and assuring that their claims are adjudicated and the insurance is paying properly so that they don't get that type of message whenever they walk in. So these are just a few of the ways that putting automations in place quickly impact the patient experience and the patient journey and provide better patient participation, patient satisfaction, and patient outcomes.
And let me ask you this. How much of the patient journey do you think could be automated, in your opinion? I mean, you're the right person to ask that to, because you've probably worked in every single one of those activities.
Well, I can assure you that within the patient journey itself, it's never going to be a full automation of life cycle. It's not like we're looking at herd mentality and running patients through on a timeline that's like an actual to scale type timeline. But I can tell you that the things that we are doing to enhance the patient journey along the way can definitely be automated. And I can put some of those into perspective for you and give you a percentage on those. The patient journey is still coming into fruition, really. There are things that can be automated for the doctors, and such as things like the doctor's notes and speech augmented for medical texting during doctor's visits. That's now being tested and tried and actually being put through evaluation. And that is a huge value add to a problem that has been perpetuated in medical for a very long time, and that is properly capturing the documentation between the patient and the provider and being able to quickly assess that information, provide back medical diagnostics on it, and then actually build the notes back to the patient. This is part of the interoperability standards that we're being required to deal with now, where whenever a patient visits a doctor, by the time they get home, they should actually have either as they check out or in hand in their email when they get home what the doctor said about their condition and what his proposed treatment plan is. That's something that has not to date ever been really fully executed upon, but now with automation we're bringing that much closer to a reality. But also things such as pre-scheduling the labs and the diagnostics and having all of that run on a timeline for efficiency and increasing proficiency in those areas. Those are things that can be automated with digital workers. But because the patient journey involves the actual patient and provider interaction, the doctor to the patient, we'll never be able to automate that part. That is the services that are provided by the organization, but we can do things to enhance the needs so that we can get rid of the doctor fatigue, such as being able to speak freely just into the room and having that pick up and perform that into notes. So the feeling of speaking with the professional regarding their medical issues has to be a primary concern with the patients. Mm-hmm. So we're never going to be at 100%, but I can say that we can get 100% of the administrative tasks that are taxing on that patient event and patient journey completely automated and get those loops together, which if you look at the entirety, that's probably somewhere closer to 75% of the patient journey.
Wow.
But that still does keep the human interactions and human in the loop activities into play and produce better experience, better outcomes, and better medical records, which is a huge plus right there.
Hmm. Hey, Brad, if I can add one thing to what Anna just so eloquently stated, is if you look at the patient journey from a value standpoint, hospitals have to be concerned with the satisfaction of the patient during that journey, because the hospitals have a problem. And that problem is usually on an annual basis, they lose about 10% of their general revenue to leakage. Patients leaving their hospital network and going to another for services. So if you look at a $1, $2, $3 billion hospital and they're losing 10% annually because of leakage, that's a significant hit to an organization that runs on a 2 to 4% margin. So it's incredibly important that we look at how we address the patient's needs and how automation can make their journey that much more pleasant, but then also making that provider who's providing those services that much more effective and increasing their time with the patient.
That's a great point, Duff. Thanks for adding that. So how do digital workers increase collaboration amongst caregivers and their ecosystem? Duff, could you speak to that?
Well, the digital worker, as we call it, and others might call it a robot, a software robot, are the glue, literally the glue that holds the patient and the provider and the organization together. So you program those software robots to go out and get specific data and share that data with the different stakeholders. And what's important about that is, and it goes back to your first question about what does the new workforce look like? This can be happening 24/7. So information can be being pushed out to both the patient, the provider, or the administrator at all different hours of the given day into their email, into their text, into their chat, whatever the case is, so that there can be a continuous flow of information, of data, because it's really the utilization of the data, the actionable utilization of it, that really changes and affects the patient journey.
We also hear about physician fatigue quite a bit these days, especially with the pandemic carrying on, and now coming back additional waves in certain states and around the world. How does intelligent automation relieve this fatigue?
Well, let's go back 10 years when the Affordable Care Act was implemented. Part of that act was the Health Information Technology Act, HIT. And what HIT said was that all hospitals had to implement electronic medical records. Well, that was great. And they had specific measuring sticks, meaningful use 1, 2, and 3. And that was the implementation, the utilization, and then the reporting. Well, I think one of the things that occurred when we created the Health Information Technology Act was we didn't give it as much thought about the physician having to sit in front of a computer and inputting all of their files. And I think Anna, who I'll turn this over to in a second, will talk about how we look at transcription as one of the ways to help physicians with physician fatigue. 100% transparency. My wife, who is a doctor, has to spend innumerable hours in front of a computer putting in her notes. And that's time taken away from being with the patient. And what you hear from physicians today, no matter what electronic medical record they use, is that they're tired of being computer input people, that they're having to input so much data and so many notes, and it takes so much time. Our digital workers, as Anna has discussed, and I'll turn it right over to her, have that opportunity to automate part of that process. And there's other pieces of their practice on a daily basis where digital workers can go out and get them information and bring it to them so they don't have to spend that much time. So Anna, I'll turn it over to you to build on what I said.
Well, Duff, in working with so many clinicians, whenever I did physicians practice rescue, just these physicians' offices that have 3 or 4 doctors in them, for example, and then you can multiply that times the number of 10,000 docs in a facility. But just those that have 2 and 3 doctors, the doctors just came out and told me, we know that we have to meet ACO objectives, but we're not going to spend that much time in front of our computer putting all these notes together. Most of them are used to speaking their notes into a handheld device and having someone else come in and transcribe their notes, which runs into one set of hands actually transcribing those notes. That doesn't really get a clear indication of diagnosis and procedures being performed. So then the nurse practitioner or someone of a medical background will come back across the doctor's notes and actually revise those to put some of that in. Then once it gets to billing, a third set of hands is touching it. So all of these different avenues really murk up the water that is the patient record and the center record of keeping for every patient around the world. So just having a digital worker being able to accurately capture the speech that the doctor says at the initial consultation And as they speak it into a microphone or to an attachment that is a part of the EMR system that is being used, or hopefully we will eventually get it to where it's something like, Alexa, I'm working with this patient, please enter these in the patient notes, and it just goes directly in. But the digital worker can pick up on that, be able to carry on a two-part conversation, accurately take that burden of fatigue away from those physicians. At the same time, other digital workers are interacting with those patient records to capture the proper diagnosis code so that there's not rework done in billing, the proper procedure code. And this is through a collaboration that we've done with other technologies such as AMC, such as Google, and efficiently combining all of that AI technology together with the glue that is RPA. So that is one way that we're, looking at combating the issues with physician fatigue specifically.
Yeah, I can see how that would be tremendously impactful. In fact, I had a doctor's appointment last week, and the doctor wrote up the report on my visit and sent it to me on July 4th. And I think he probably would have rather been doing other things on the July 4th holiday than writing up my appointment.
Yeah, Brad, if I could add one thing to that. A lot of organizations that we work with are teaching organizations and have large research and development divisions that are working with pharma companies. And one of the things that physicians hate doing is filling out the documentation for grants. And this is just a simple user case, but those filling out applications for grants take weeks and months. And if you can use a digital worker to populate those applications, you can free up the physician's time exponentially. And I was just talking to a gentleman that runs the R&D area at Children's Hospital in Boston. And he just deadpan looked at me and said, "Really? We can do that?" And I said, "Yeah." And he goes, "How fast?" It's not about can we, it's about when can we do it? And we can do it now.
Yeah.
And I think a lot of organizations aren't aware of that. We're not talking about the art of the future. We're talking about the art of now.
So let me touch on a topic that's definitely sensitive and a priority area for healthcare, and that's data privacy. It's such a huge issue in healthcare. How do you adequately protect patient information when you're utilizing intelligent automation? Well,
that's the beauty that I saw in working with RPA and robotics, because like you said, it's been a huge thing in my career, dealing with, okay, how are we implementing health information protection here? One of my internships out of college was helping to write the HIPAA documentation. So I knew that it was a big part. Then as it became enacted and all the businesses had to comply with how much professional information, and then especially whenever I was working with immunocompromised patient records within the health department, we had them locked in a back room in a black box, and no one was allowed to even go in there. That's the kind of level of protection. When you're working with a digital worker or with a robot, you're looking at a non-human that is not taking into perspective what is on that documentation. They are moving and processing the documents and the documentation to the places that they need to go. How we use that technology to encrypt and apply HIPAA regulations and regulatory requirements is that we encrypt the data in transit. So going into the technology itself, it is all encrypted. Once inside the technology, it is masked. So if anyone happens to view it in a log or anything like that, all of the technology is masked. But there's no personal health information ever housed within our technology. It is strictly as though you and I had no eyes to read what was going on, but we were interacting with the data and moving the data interoperably between systems. But everything is done according to HIPAA regulations, masked, dual encrypted, and even if you pull the logs, all you're going to see is, okay, this digital worker pulled this information from here, input it into here at this particular time, and the next time. And if you wanted to say what record was that, then you have to go back to the source of the records, which are already encrypted and HIPAA protected from within the organization that they're being developed and utilized from. So those are some of the game changers that I saw from using robotics versus actually using human factors. There's a lot more data that's exposed to the human entities that are working with that data than there ever would be to a digital worker that is working in that same, doing exactly the same tasks, right? So to me, that made it even more secure than just actually applying a HIPAA code or HIPAA regulation. But to meet standards of interoperability, be concise, we do have VBOs that are HIPAA VBOs that are de-identifiable data so that we can just strip out any kind of PHI out of the information so we can use it for research purposes, such as in digital twin modeling and things like that. So those are different ways that we make sure that we fit auditability status.
Okay, excellent. Duff, let me ask you, can you utilize intelligent automation to build an agile, transformative environment in healthcare? Is that possible?
Yes, it is. The reason I say yes, it is because I think we've evolved. So I think 10 years ago, 15 years ago, when Blue Prism was the pioneer in RPA, some of the criticism was that digital workers could only do A, B, and C, and it was rigid. It wasn't an agile solution. But today, we talk to organizations that are looking to put in digital pathways and digital platforms that incorporate not just automation, but also artificial intelligence and machine learning. And by the marriage of these three technologies, what you're doing is you're developing a platform that can transform along with the organization. And I think that's what's really important today, because if you look historically at RPA, it was this, and again, I hate to say it this way, but it was taking menial tasks, repetitive tasks, and just automating them. Today, with what we have, we're looking at automating full workflows. And we are listening to our customers and our end users, and they're telling us that we need these extended workflows to be able to adapt to this new environment. And I think a good example of that is the onset of telehealth and how digital workers integrate with telehealth, and the value that we bring to physicians up front in how we adapt and take information and distribute information, et cetera. So I hope that answers your question.
Yeah, absolutely. So let's talk about the implementation of this solution in healthcare. That's got to be a question on a lot of people's minds. How exactly do you achieve this robust, scalable enterprise deployment without the lengthy development timeframes?
The Blue Prism Enterprise Platform is the most secure, scalable, and robust platform innately built for the use of RPA as a platform itself. It's been tried and tested. It was born into the financial realm and has expanded into other industries from there. So the scalability that you find within the technology is untouched in the industry. So our quick to deploy assets that are now being created upon our marketplace, as well at which we call the digital exchange, but as well as other partnerships marketplaces, is growing daily. More and more quickly, we're seeing entire solutions come together with new tools for no code and design that we've just developed that just came to market in January. As part of our Blue Prism suite, we can now go from design to production and cut that timeline by 50 to 80% using these new design tools. I even learned today that our new capture product, which allows us to capture processes while they're in motion, you can actually not only design your design documents directly from there, you can now export scripts from there, and the J code and everything that actually allows it to be imported directly into Blue Prism. So we're cutting back more and more often on what it takes to reach design to deployment strategies in very short periods of time. And then whenever you add the fact that we have multiple models for deployment, such as cloud, SaaS, or on-prem, so we can go from zero to actually standing up processes, reaching ROI for certain processes in days, not months. Specifically in healthcare, our experts have identified certain processes that are in every area of healthcare. And every time you walk into the place, you see the same issues. We know that those are freestanding processes that can be automated quickly, that are going to bring true ROI and continue to give ROI annually. If you target those low-hanging fruit, you walk in with a ready-made, ready-to-stand-up type processing, Blue Prism Enterprise platform, you can be up and running and receiving return on value very, very quickly.
What is a realistic timeline then for a medical center to realize savings from digital workers?
Well, I can tell you that beginning with the first process, which can be stood up in any business unit of an HCO or an ACO, you're going to see return on value within around 3 months. As long as you get the software stood up, you get that process going, you're going to see immediate value. Your long-term value is going to come from deploying entire workflows within every business unit, targeting every single place that you can plug in another digital worker or another process. Whenever you look at automating entire workflows, your value goes through the roof. Now, those may be a 2 to 3 year deployment. They may require much more enterprise thinking of looking at each individual. Say you have 500 clinics. You may be able to get one clinic up and running, all digitized, completely digitized from end to end, and then have to replicate that across the other 499. So that would be a lengthier deployment, but imagine the return on investment that you're going to get out of a deployment like that. So it's well worth the investment. You can start small, go big. You can start big, build over time. That's what the beauty of Blue Prism is our ability to create those models of deployment for you.
And if I may add, Brad, one of the things that we use with our customers is something called the ROM. It's a robotic operating model. I've renamed it. I call it BAM. It's the business automation model, because we like to look at hospitals as businesses. They have all the same attributes as a business, and we need to be able to provide them with a model that incorporates the change management, but it also, what it does is it brings in the accountability of leadership to take a hold of bringing in intelligent automation and making sure that its value is brought down into the workers so they understand and they get rid of the thought that they're losing their job to a robot. It's not about that. It's about how do you encompass the enterprise and take tasks out of someone's hands that can be automated and let them focus on more complex enterprise value opportunities that really help organizations become sustainable. And I think that's part of the word that's so valuable in the business automation model, is that we're really helping organizations reallocate assets in a very timely fashion via the cloud or on-premise, and we're helping them realize the value in a short time period because they have that alignment from senior executives down through the workers. And I think that's very important for organizations to understand, is that there is a model for them to follow, and we can help them with that, or their systems integrator or regional consultant that they might be having, helping them transform, innovate, and become more sustainable.
Okay. So let's end with this. Anna shared some great examples of healthcare organizations realizing benefits from automation. Duff, I'm going to put you on the hot seat and talk about ROI, which gets called into question a lot. So perhaps you could end us by sharing maybe just one really good example from your experience of a healthcare organization that's realized real dollar savings from intelligent automation.
So you asked for one, I'm going to give you two.
Okay, perfect.
We have an organization here in Boston that has realized in hard dollars over $10 million in savings. And we're not talking about in hours. We're talking about $10 million in savings. And why do I say that? Because they've outsourced services and they've been able to bring them in-house and use digital workers to provide that service. So that's real money. We have an organization in Florida that has realized over $6 million in savings. And they have over 70 automations going from back office to clinical. And we're more than happy to sit down and share what they've done. But the one constant that they've shown is we're not talking about soft dollars. We're talking about hard greenbacks that organizations are saving. And they've put together metrics where if they're going to automate a process, that process has to save them at least $400,000 to $600,000. And I think that is the right business model to follow. And the reason they've been so successful, and I'll go back to one of my earlier statements, is because they have alignment throughout their organization in what they're doing. And that alignment is based on a model that builds collaboration. And those workers understand that what they are not doing and that robots are doing, they are now able to focus on bigger value added initiatives for their organization. A lot of those new initiatives that they're focused on are patient-centric, because that's what Blue Prism really believes is the secret sauce to a successful organization. It's being patient-centric and making sure that patient value, patient safety, and patient outcomes are really the end result of using automation.
Fantastic. Duff and Anna, thank you so much for your time today. You guys were absolutely the ideal pair of colleagues to involve in this conversation. You really know your stuff in the healthcare industry, and certainly it is poised for a lot of change, a lot of good change, and Blue Prism will be right in the middle of it. So thank you for your thoughts and your insights, and be well.
Thank you. Thank you for this opportunity.
Thank you very much, Bud. Appreciate it.
Thanks for tuning in to Transform Now. For more insightful discussions on digital transformation and more, check out our podcast channel where you'll find all of our previous episodes. To make sure you never miss an episode, subscribe to the show on your favorite podcast player. And if you like what you heard, please leave us a review. For more information about digital transformation and the future of work, check out blueprism.com to learn how Blue Prism's digital workforce is enabling enterprise transformation now.